in today since 2009, so I've been there for quite a while. And I have 4 children of my own, 2 of them who were C-section babies, the first 2, and the 3rd and 4th were born at home. So I went rogue. I was like, I'm out. I know my body's not broken.
Yes.
I know that I can do this. And I had intentions of home birthing my first one, and I'll share a little bit about that experience. So a lot of what I do in practice is not only based out of my education. I have a doctorate in chiropractic, a doctorate of natural medicine, so I teach on nutrition and lifestyle and spinal hygiene and musculoskeletal care and all of the elements that go into leading a lifestyle that's going to create the greatest outcome possible of the epigenetic exposure. But as a mother, my experience was very different. I kind of was hard-lined when I first started in practice. I was like, I would never go to the doctor, and I want to avoid medicine at all costs. And I went into my birth experience as an athlete. I had run 10 marathons, and I had done a half Ironman, and I was a chiropractor. And so as a chiropractor, I'm bent over patients a lot. There's a lot of twisting in the pelvis, and so I know that I'm following Cora, who is a dear friend of mine. We've worked together with a lot of mothers and babies and at birth together, and so she helped me a lot in my experience because sometimes you just don't know what you don't know, and yeah, it's big. Yeah, I went into my first birth being like, I can do this. I am strong. I can do hard things, and then my body just did not want to go in swim birth. And so I pushed it, and I went to 43 and 3 with my first baby.
Wow.
And then the noise of my family got in my head, and they're like, that baby's gonna die, And we ended up with a failed induction and a horrible experience. But I had a midwife. Mary was my midwife at that time, and just an encourager, and but she still was there, and the postpartum care shines from the midwife. I want to cry when I think about it, of how she stepped in. It was a very traumatic time for me in my first birth, grieving the experience of I made a decision that I was going to home birth this baby, and then I with my second was going to do a VBAC in the hospital, and everything was textbook. And then I had a midwife acting as a doula. She's no longer in the state anymore. And I didn't know this, but she had several births right on top of each other. And then I was like the 4th or 5th. And so we're in the hospital, and I gotten there, dilated to a 3. 12 hours later, I'm dilated to an 8. The OB comes in, he's like, you want to have this baby? And I had said, I don't want my water broken. But I was like, yeah, I was tired. I had prodromal labor for days. And so he breaks my water. I go rest in the tub, and there's a shift change. And a new nurse who looked about 10 years old. And I told my husband at the time, I said, I don't want her as my nurse. When you just have that feeling? And I'm not like that at all. I don't remember, I don't know why I had that feeling. And my husband didn't honor it. And he said, that's your nurse. And she checked me, and I'd gone right back to where I was 12 hours before when I had come into the hospital. So I'd gone back to 3. I was so defeated. And my water had already been broken. It was just a classic sphincter response. The baby got up. And I asked my doula, what should I do? Because I was so tired. My body was trying to push at that time. And she's like, just get an epidural. Well, I had never had a drug in my life. And they gave me besides the first C-section, that was a spinal. And they gave me an epidural and tanked me. And they forgot to hook up the blood pressure cuff. And And so everybody leaves the room except for my husband and me. And I was like, I don't feel right. And he's like, oh, you're just tired, just go to sleep. And I was like, no, I feel like I'm gonna pass out. And he's like, yeah, you're just tired. And I said, go. And I was like, go get the nurse. And it was like this last ditch, like, please go get somebody. And they came back in and they'd forgotten to hook the monitor up. And my blood pressure was like 80/50.
Oh.
And so then it was epinephrine and this whole thing, and they could never get contractions going again. And so ended up with a C-section the next day. And so my third came 3 years later, and like, so the talk I'm going to give today is caring for the newborn spine, but it's also the preparation for the newborn spine through the mother. And I love that I got to speak. I love it and hate it that I got to speak right after Cora because she's so brilliant, you know. But they really piggyback on top of each other, the positioning and the balancing. And so I had seen a pelvic floor PT, and what was wrong was my pelvic floor was so tight. And so for your women who are athletes, these are the ones that are like, I'm strong, I can do this. It's like, no, you don't do birth, you allow birth. You have to allow birth. You don't do it. And so, like, your voice as a midwife is so potent to these mothers that I want to make sure that you know that. Like, you know what I use, Mary, with my patients to this day? I use these two words when they're waiting to go into labor: divine patience. Because she spoke that to me 12 years ago. Your words are potent. Be cognizant and intentional with every single thing that you say to your mothers. Be very, very careful with your words because you can impact them in a very, very positive way or a very, very negative way. So your intentionality is so vital in how you're speaking and communicating. So I went on this journey of like, my body's not broken, figuring it out. So everything that I do in practice is research-based. I'm really analytical, but is also experiential from my own experience and the hundreds and hundreds and hundreds of pregnant moms and hundreds and hundreds and hundreds of babies that I've had the privilege and honor of taking care of in my practice. And I want to thank you all because I know a lot of you in here really, really deeply and well, and you refer your patients to me and babies to me, and I want you to know that is such a gift and such an honor. I do not take that lightly. Every time I just think, wow, they trust me with your people. It's a big deal. So the pelvic floor is such, and you're going to get a lot of, I'm sure Cora talked about that, you're going to get training on it tomorrow as well. Having that balanced for birth outcome, like ease in bringing a baby into the world is so vital. And that's speaking from experience. And that is a lot of what I do in taking care of my pregnant moms and babies too. So, but for the purpose of today, we're going to talk about some things that you can look for in your newborn assessments, when you're doing postpartum care with your moms and babies, and things that you can do with them and for them, things to look out for, how to assess when there might be misalignments or imbalances in the nervous system, and then how to really be proactive with these moms. Because again, on the way here, I was talking with a really dear friend of mine. I was at the birth of her second and third baby. The second one, Shay, well, both of them, Shay and I worked together. She was so balanced and aligned with her second baby that she lives right across the street from me. I got there. She calls me, she's like, my water broke. And I said, great, have you called the midwife? And she's like, no, not yet. And I'm like, well, do that and I'll be there in 10 minutes. So we get there, the baby's born like 30 minutes later. We have Shay on the phone. She's like speeding there as fast as possible. And, we're sitting in this space of this beauty and presence, and Shay's like, are you all okay? And so as I was talking to Holly on the phone, I said, guess what I get to do today? I get to go be in the presence of these incredible women that are on the daily, encouraging women and bringing babies into the world. And I said, from a mom, from your perspective, what is something that you wish she would have known, because she's pregnant with her 4th baby now, would have known on the front end, like what to do, and or what would it feel like her first baby was born in Nashville. If you had the information that you have now, how would it look different from you? And she is one of the ones that told me, and that reminded me that she said, I trust my midwives and who I bring in my birth team 1,000%. I will do whatever they tell me to do. So that's coming from a mom who's pregnant with her 4th baby. So that's a lot of pressure, but it's like, let that sink in and sink in deep. The other thing she said, if I would have known how impactful and powerful getting my baby's checked right away, even if there was nothing wrong, how impactful that was, I wish somebody would have told me right away. Because her first baby dealt with allergies and vaccine reactions, where her 2nd and 3rd have not, because she knew differently. So we're going to talk about, these things, like if mothers knew that if their babies would latch better, if the babies would sleep better, if the babies were more comfortable, if there was less gas and reflux and irritability, if there was less rigidity in a baby, like all of the things to look for that are signs that something's not right. And sometimes moms will say, well, that's just how it is, it's just baby, just get used to it. My father-in-law used to say, well, the baby's crying because he's exercising. What? Give me that baby back. That just doesn't feel right. Same thing. Don't like that nurse? Don't like you right now. When it doesn't feel right. The other thing, the challenge that you have right now is there's more knowledge than ever out there. And I'm sure, am I right in saying you maybe struggle with that a little bit? Because sometimes moms will think they know more than you do.
Exactly.
Oh, I saw it on social media. So I just did a nursing consult with a baby, a mom who has a newborn, and the baby was having reflux and choking, and the mom was like, well, I just have a strong letdown. It's her 2nd baby, and I said, well, let's just schedule a time to talk through it. And so she was doing, what is this hold called that moms are doing now? Big boo. So she was, holding the baby like newborn baby, and then nursing the baby like this, sitting. And this is a social media thing.
Yeah, it is.
It's this Australian woman who thinks she.
Is it the Thompson?
No, koala.
Oh.
It's koala from Australia.
Yeah,
It's very
yes.
popular.
Yes, very popular. So she does have a strong letdown. She's nursing the baby like this. The baby's an extension.
Yeah.
And can't move. So the baby's here, nursing, can't pull off but also, who drinks like this? Can you imagine? And like, if it's coming too far, unless you're in college, it's just not sufficiently gonna do the right thing. So even be one step ahead of them. I said, I want you to just try a classic hold. Baby did great. I said, you're gonna get that. What's happening is the baby's an extension, hasn't let down, and then can't swallow fast enough, can't open, because that's an extension. Okay? So sometimes it's these simple things. Do not be afraid to say that is wrong for you. Okay, I know that might be working for everybody else who's up on koala, and it might be great for some moms, but it's be the expert and don't be afraid to say, look, I know that there's a lot out there on social media, but if anything, understand that moms are overwhelmed. And when they are overwhelmed, they're going to be there trying to nurse their baby in koala hold or whatever they just learned that they saw on Instagram or TikTok or whatever. and get more overwhelmed because there's too much information and too much knowledge. And then you have to help them look to the cause. Sometimes moms can be so overwhelmed, they have spent so much time preparing, especially first-time moms, to bring this baby into the world. That is such a short amount of time, and not preparing for motherhood. And that's where, again, this postpartum care as a midwife, where you shine. Like, I tell moms to have home births just because they get to have somebody come to their house and check on them, and it's incredible. So I'm going to teach you some things that you can do bedside in addition to your newborn assessments to help to see if there might be some neural tension. So it's important to know that the nervous system controls everything in the body, everything. And a baby's nervous system is wiring and firing so fast in that first year that if there are imbalances on day one, or from birth, or in utero from an asynclitic position, or malpositioning, transverse or breech for a while, then they are going to have a hard time in development, period. So these basics are foundational for development down the road. We always want to begin with the end in mind. Think about your first assessments you're doing with the mother. You're beginning with the end in mind. You're talking to them about their lifestyle and movement and things that they can do to have your outcomes, your time at their house be safe and maybe faster or whatever that looks like. And so we want to begin with the end in mind. So what are some things to look for where there might be some neural tension in the baby or misalignments? Any ideas? Yes.
A head that is off to one side.
That's yes, a head that is off to one side. That is one of the most common things that you'll see is the baby gets in, the car seat and they're just kind of holding to this side. Just looking for that is really, really important. Yes.
Them not wanting to nurse on one side, but
Only on one side, yes. Why? Again, we have to look at the cause. That's not normal. And there may be some differences in the mother's anatomy too. She may have a slower letdown on one side. The nipple may be inverted on one side and not the other. So there's some variables that you can look to help her with, maybe a nipple shield on one side. It's not always the baby. Maybe it's the latch or positioning, but that is a really clear marker. Yeah. What else? Anything else that you can think of?
Is holding the head up and stiff one?
Yes. Rigidity is a big one where the baby's, kind of rigid. That is not normal. A baby should be nice and, be able to hold them nice and relaxed. If they're stretching out or arching, very clear sign. In fact, that's one of the more dangerous signs that we need to really get ahead of quickly, okay? And I'll teach you some things to look for. Like, you'll feel it in a baby. You know the difference between the really snuggly, just cozy babies and then the ones where you're like, gosh, I just can't even really hold you easily, Yes. What else? Any other?
Constipation or what people think is colic.
Yes, I love that. Constipation, or what people think is colic. Colic is a name, a label that pediatricians have given to babies when they are uncomfortable and crying for hours and hours and hours at a time. It is something that they say to the mom, oh, it's just colic, they'll grow out of it. What? Maybe. Maybe. But what was that?
Every baby.
Yeah, every baby has colic. Yeah. There are very clear differences in what normal crying is and signals of hungry and tired and wet and gassy, and those are things to teach a mom of what to look for. But wailing, screaming, discomfort, that is absolutely not normal. And it's not exercise. Yeah. Constipation, such a dad thing. Constipation a lot of straining, grunting. Part of that is the digestive system waking up and starting to work again. So it's ensuring that the meconium is clearing and the baby's getting used to that, but it's also not normal. Okay, good. What else? Anything else you can think of? Of what?
Head on one side of
Yes.
that. Asymmetrical.
Asymmetrical tone in the body of the baby. One side's really tight and rigid, maybe one leg's kicking straight out and one's kind of frogging. You're seeing some asymmetry in the baby. That's a really good one. Yes. Good. Anything else? Another one is just really difficult to settle, and there's a difference between a colicky, name, and then a baby that's just uncomfortable and really difficult to settle. And sometimes that's the mother. Sometimes the mom is so, the moms that are the panic patters. I'm like, how is that baby gonna settle down?
Better.
Yeah, or the panic burpers, or so the little things like just teaching a mom how to burp the baby, and different positions of how to burp matter, because some babies are different, and just based on your experience and all the newborns that you see, is sometimes they just need a little pressure on their belly, maybe getting them up over the shoulder a little bit more. You want to be thinking about the anatomy. The belly is right here on this left side. And so if there's a little bit of pressure on the belly with some movement, firm movement, upward pat, it's magical. There's some other things too, of just being able to move the baby in a circular position. That's helpful, but not for every baby. Oftentimes just this forward leaning, lots of pressure, upward pat, it brings the air up and out. Remember, teaching a mom that air out the top is much more comfortable than going through and out the bottom. Okay, so have them fight for the burp. Sometimes that just makes a huge, huge difference in the comfort of the baby, and it has nothing to do with their nervous system. It's just, especially those moms that are second, third, fourth time moms that have a stronger letdown because their body has memory. They need to take a break. Some of these moms are nursing a baby in 4 minutes because they have a strong letdown. So every minute they should work for a burp. Okay, so those are really, really important things. Good. Okay, so let's talk about a bedside assessment that you can do for these newborn babies. So one, I wish I had a real baby here, but this one we're into. Oh. There she is. See. Put this baby down, so that we're right to put her on the floor. Okay. What's your name? Sayla. Hi, Sayla. Oh my goodness, Sayla.
She's just smiling.
It's your turn. Yep. Just say hi. The star is born. Oh, hi. Hi. How old is Sayla? 5 months. Okay, so
I wonder how we're doing.
So this is a pillow that we use for newborn babies. We have different sizes, but hi, sugar. Hi, precious. Oh, you look happy. Has she ever had chiropractic before? She's had
CFT,
okay.
but not classic.
Okay. Well, we're just gonna do a little check. Yes, you have. Take your little socks off. It's not necessary to do this, but I just want to show you something. I know. That's what I did to me. Talk to me. So one important thing, and she's 5 months old, so her nervous system and musculature is a little more developed. But we look at plantar and dorsiflexion of the feet. And in a newborn baby, they don't have any strength yet. And so they should just be really loosey-goosey. And if we're seeing restriction, so, hi. So, a little bit restricted this way. Still in even a 5-month-old, you can see how there's really easy, good movement here. And this one specifically on the right is a little more restricted. So those are things to look for. Again, in a newborn baby, those feet, you won't have any fighting at all on it. And then you do the same thing with the hands. And so really good flexion, really good extension. And chiropractic for babies is super gentle and easy. Oftentimes our newborns just sleep right through it, okay? So those are some of the two things. We always check for reflexes on the newborn reflexes. You're doing that anyway. And so Babinski, of course, and some of this moral reflex and so she's high, so fun. The next thing we do, and this is a really good, easy check for you to do at home or at bedside, is just feet to the forehead. And this, when you have really gassy, colicky, rigid babies, they'll get sometimes like this far. You could force it over, but it's shocking. I mean, classic sign of that a baby needs to be adjusted if these feet are stuck here. A baby should just fold right over. You see, Mama? That's making you happy. So just like this. That's what it should look like for you. So that's a really clear baby. There's no fighting it. Super fold right over, and they don't mind it. Another thing you can do is just check left and right. Really great movement with this baby. Yes. Yes. I know. So if the baby was really restricted this way, I would recommend referring to a pediatric chiropractor, someone who takes care of babies. If you're seeing a lot of restriction in the hands or the feet, that would be another time. And then I'm going to turn you right around. You ready? Hi. You can also, raise your hand if you're checking for tongue ties. About most of you. Okay, that's another thing too, that if the baby is tied, refer them to a chiropractor that can also check for that as well to confirm, but also to do work in the midline. There's so much tension in the nervous system in the midline that happens when the baby's tied.
Are all chiropractors knowledgeable on tongue ties?
No,
Okay.
no. And I can't even tell you who
Okay.
would be. I know that even my
That's what
associate
I wondered.
isn't comfortable and doesn't check.
Okay.
And she would prefer that I do that.
All right.
So, and it's knowing. I can give you, I know of 2 others in Little Rock area. Well, and I don't even know if they check for ties. I know that they adjust pediatric.
Okay.
I might need to check on that for you.
Yeah, would be nice to know. There's a couple.
Yes. Hi. So those are some things you can do bedside. If you're unsure, or if, let's say you're out in the country and like, you know, an hour or 2 away from any chiropractor, what are some things that you can do to help?
Yeah.
So some things, easy things to do would be to take the neck or the head, and I'm not going to adjust her right now, but it's just to do some pumping. Like if you get your fingers under the occiput, that's the base of the skull, and just apply a little traction and do some pumping to help that cerebral spinal fluid flow through the spinal column. Sometimes that's all a baby will need, okay? I do a lot of work on the cranial bones with babies. So if you're checking the fontanelles and you're seeing any imbalances, you're seeing maybe, let's say that baby was really, had an asynclitic position, you're seeing a large, coning on one side of the head more than the other side, I would, if that was my baby, desire an immediate referral to a chiropractor, okay? Because we need to do some work both in the hard palate and in the cranial bones and the sacrum. They all are connected, and make sure that we're getting good cerebral spinal fluid flow. Those cranial bones will stay open from 18 to 24 months, okay? That's when they'll start to close. Hi, you taking it all in.
She likes what she really does.
Yeah, and this is typical how babies will do when they're on the table.
Right, that up, yeah. I watched you do that.
Yeah.